Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. On today's episode, we're going to do one of our favorite types of episodes, which is Q&A, question and answer. As you know, we prompt people on our social media platforms like Instagram, and then we try to answer your questions so that, this can be useful in addition to being entertaining. So I'm always, I'm joined by Maria, my famous producer. Hi, Maria.
Hi there. I don't know about famous, but okay.
You're famous to our podcast listeners. They know who you are. You're Maria, the producer. That's how we've been. That's how you've been labeled. Okay, Maria. You told me some good news. You told me that we had a few positive reviews. You guys, you don't know how much I love positive reviews. The reason I love positive reviews is it keeps me going. Do you know what day it is today? It's Sunday. Do you know what I'd like to be doing? Driving or hanging out with my child. But I'm here recording a podcast. Why? Because I love the fact that people listen to it. And I love the fact that people learn from it. And I love the fact that people make good choices from it. So as a professional and as an academic person, I'm committed to doing it. But I'm not going to lie. When you guys leave positive reviews, it really makes me happy. So tell me the two positive reviews that we got.
Okay. This one was mid-May. It says, real and down to earth. Frequent listener of this, it's real and down to earth. Guests are great and the topics discussed are important and usually don't get as much attention as they should, particularly in our age of Instagram surgeons, pediatricians who can put out the plastic surgery shingle and start operating with fewer qualifications than should be required.
Wow, that was a fantastic review. Real and down to earth. Well, that's what we try to keep it, right? We want it to be realistic and we want it to be relatable. So down to earth.
No filters.
No filters. Yes. Plastic Surgery Uncensored. Okay, go ahead.
The next one is informed. This podcast is so informative and entertaining. I can't stop listening. I'm done with fillers, ultra therapy, and threads, saving my money for facelift. I wish I had started this earlier. Excellent fun to listen to and educational as well.
Awesome. Well, we are grateful that you guys left good feedback. Obviously, if I got a bunch of shitty feedback, I'd stop doing this, right? I mean, let's be honest. If you're not listening, I have better things to be doing. So it makes me very, very happy. So let's dive into the questions and answers. So if you tend to write them in, listen for your name. We try to give you a little shout out. What's the first question?
Okay. The first question comes from my realtor, Heidi.
My realtor, Heidi.
Tummy tuck scar, how to remove the ugly scar.
So the question is, tummy tuck scar, how to get rid of my tummy tuck, ugly tummy tuck scar. The answer is you can't remove a scar. So we get a bunch of questions and then I decide which questions I think are useful because I'm trying to answer questions that would apply to the general public, right? Questions that other people would ask. And people ask all the time, how do I get rid of my scar? And the answer is you can't. You can never, ever get rid of your scar. What you can do is try to create a nice scar, a scar that's not unsightly, as opposed to an ugly, thick, brown, nasty scar. But the notion that plastic surgeons have this magic wand that they can get rid of scars is not real. It just, anyone who tells you they're going to do scarless something, it's just not possible. So to answer your question, it doesn't matter if it's your C-section, your tummy tuck, your breast reduction, your gallbladder, your bypass surgery. It doesn't matter what the surgery is. You can't get rid of the scar. You can only hope that the scar will be nice and thin. So you have to do a scar revision. You need to have someone cut it out and reclose it and close it well. Then and only then can you hope that you will generate a nice thin scar. Does it always happen? No, but usually it does.
I brought up that when I did my first C-section, my scar was thick and not very pretty. And the second C-section I got was nice and it's like a little vine. Yeah,
so there you have two, right, but you're the same person. What did the person tell you after the first C-section? That's the way you heal.
Right. Exactly.
And so patients walk around going, God, I make shitty scars. I wish I could do a breast reduction, but I made such a horrible C-section. I will never be able to have the scars all over my breast. You didn't make a horrible C-section. They did a shitty job.
Okay, next question comes from Anna Grills. How non-surgical aesthetic procedures impact plastic surgeries later? Unintended consequences.
That's a fantastic question. Very, very intelligent. The question is, how does all this non-surgical nonsense that I'm doing have an impact on surgeries that I want to do later that I didn't anticipate? Beautifully said. So how it can impact it is that if the non-surgical procedures you're doing in some way, shape, or form damage your anatomy, then when you go to operate on that anatomy 5-10 years later, you will not get the outcome you would have had your tissue been native and healthy. Perfect example is all these thread lifts that you do in your face, right? You shove all this plastic or whatever, I don't even know what the hell they are. Barbed threads, blah, 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 nurse practitioners, estheticians, whatever. So all this stuff is going in your face. You're doing it temporarily because you're invited to a party, I don't know, the Oscars, whatever. And then 10 years later, you're like, I need a goddamn facelift. And then your surgeon's going to open up your face and see all kinds of shit, barbs, scar tissue, weird planes. And you're not going to have the same outcome as if you just didn't do those terrible barb suture things. So, you know, some things are great. Botox, you do it, it goes away. You do it, it goes away. Is there any long-term sequelae? No. When I go to do a brow lift, will it affect it? No. Okay, great. And some things are terrible.
Okay. The next one is from Daisy, Maryland.
Daisy, Maryland.
Is it important to know who your anesthesiologist will be?
So today we've had a lot of really good questions come in, and I love that one. Is it important for you to know who your anesthesiologist is? Hell yeah.
We had an episode on it.
Are you kidding me? Yeah. People are all like, oh, I'm so worried about plastic surgery. Oh my God, I'm going to die, blah, blah, blah. It's not your surgeon that normally is going to end up killing you. It's anesthetic complications that end up killing people. Mind you, it's all very rare, but you want to know who your anesthesiologist is. So what's the problem? You never know who they are. 99% of times you go to a doctor, you say, hey, I want to have whatever. My boobs done. I want to have a nose job. I don't know. I want my gallbladder out. You do a tremendous amount of homework on the surgeon. I mean, my God, you stalk them. You know everything about them, what school they went to, blah, 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 and you pick them. Then they take you to surgery and put you to sleep by someone else. There's another person doing the anesthesia. So what happened to all that diligence and homework and credibility and all that? Did you do that for the anesthesia? No. Well, how was I supposed to? I don't know who he is. No, because no one tells you.
But in one of your episodes, you talking about how to prepare for surgery, you said you should always ask. You should ask,
who's my anesthesiologist? I want to talk to them. Are they board certified? Are they trained? Are they CRNA? You can ask those questions. You might get a little pushback. Why would you get pushback? Because the surgeons use a tremendous number of anesthesiologists, whoever happens to be on the schedule that day, or the surgery center, which has nothing to do with your surgeon, will select it. In my instance, I curate my anesthesia providers. They are mostly two, and one of them is on the show with me, and I only use them, period. That's it. They've been vetted. So you want to talk to them, we'll introduce you to them. But that's a great question. And then 99% of times, you have no idea who's doing it.
And that's what people are more scared of is
of course.
From anesthesia.
Yeah.
Okay, this one comes from SG Valgry.
SG?
Valgry.
Okay, at Valgry, yeah.
I have high blood pressure. I'm afraid to have surgery because of it. Should I be concerned?
Yet another wonderful question. This person says, I have high blood pressure. I want to have surgery. Should I be concerned? And the answer is maybe. What does maybe mean? Maybe. Does the fact that I have medical problems in and of itself a problem? No. You could have diabetes and have surgery successfully. You could have blood pressure issues and have surgery successfully. You could have had a stroke. You could have a lot of things. The question is not, do I have them? The question is it well controlled? Is someone taking care of my diabetes? Is my blood pressure under control? So, scenario one, patient comes in, they have high blood pressure. no doctor is really managing it very well. Their blood pressure's all over the place. They have spikes, then they drop. They're not on the right medications. And then you operate on that person and they drop dead. Then you're an idiot. You should never have operated on them. They were not a good candidate. Then you operate on a person with high blood pressure who's seeing their cardiologist once a month. They're dialed in. They're on beta blockers. Their blood pressure is stable. Their blood pressure is better than yours. And you operate on them and they do amazing. So the answer is maybe. Not the disease, but rather how well it's treated.
And what your circumstances are.
Yeah, and then you get a medical clearance. If I were operating on a patient with high blood pressure, I would consult the cardiologist. Hey, is this person safe? Are they well controlled? Do you have any concerns? Should I do something during surgery different? You know what I mean?
Okay, so let's go for a break. And when we come back, we're going to talk about male boobs and reconstructive surgery.
Oh, exciting. Male boobs and reconstructive surgery. Ooh, exciting. All right, let's take a quick break. We'll be right back with Plastic Surgery Uncensored. Welcome back to the second half of Plastic Surgery Uncensored as we discover what wonderful questions you have and give you entertaining and educational answers. So we're in the second half of Q&As. Fire away. What's the next question?
Okay, the first question comes from @BV. Every time I get a filler injected in my face, my body absorbs it really fast. Why is that? And what should I do?
Okay, so that's a good question. So I get injected with fillers, it just disappears. So it turns out that absorbable fillers, which are the only fillers I use, it means I put it in my body and my body will absorb it. Absorb at different rates in different people in different areas. Absorbable fillers absorb at different rates in different people in different areas. So what does that mean? So all absorbable fillers are not created equal. Some are thin and designed for really thin wrinkles. Some are thick and designed for very deep tissue. Thinner filler disappears quicker than thicker filler. Then filler in the nose, when I do a liquid rhinoplasty, may last 1.5 years. Filler in the lips may last 3 months. Same filler, same patient, different area, different blood supply. Then same filler, same area, different people. Oh my God, my friend gets her lips done, it lasts 7 months. I get my lips done, it lasts 3 months. Same area, same type of filler, because we have different metabolism. Some people, their body breaks it down quicker than others, even if it's in the same place as other people. So it's hard to say what the reason is, but it's not uncommon that certain people, their metabolic rate is higher and therefore choose through the filler quicker than others.
So her option would be facelift?
Well, no. Her option when it comes to filler is try different fillers of different cross-linking manufacturing and see if that makes a difference and see if the filler absorbs quickly in all areas. Similarly, to see if the issue is area related, like I just can't do my lips because my body eats it up. But when I use it in my cheeks, it lasts forever. So you have to do a little bit of investigative homework.
Got it. Okie doke. The next question comes from K Smith 0919.
K Smith 0 something or another 19.
0919.
0919.
Rhinoplasty recovery and swelling timeline, normal versus abnormal.
That's funny. We did another segment with my nieces regarding rhinoplasty swelling. So it varies, which is normal, and then it varies, which is abnormal. So with a certain surgeon who does good work, you're going to get some variability. You can have a super clean recovery, which means you have little swelling and little bruising. Same surgeon, different patient, and you can get moderate swelling and moderate bruising. It's quite uncommon to get severe swelling and severe bruising in surgery that's done well. That being said, in some patients, the swelling and bruising last a few days, and in some people, it lasts a few weeks. And last but not least, swelling is just this huge concept in rhinoplasty. So swelling lasts like 2-3 years. So we have to be very specific as to which swelling we're referring. Long-term swelling, which takes forever to go away in everyone's nose, or short-term swelling, which is operative swelling, which is, I just had surgery and it's been like a week. So there is a short-term, which is like 2-3 weeks, and then your nose looks pretty good. And then there's long-term swelling, which is, God, it's taken forever, all the swelling to go.
Okay. Next one comes from Karen Rod.
Karen Rod?
Rod. During breast reconstruction surgery due to breast cancer, my nipples were removed as well, and I'm left without nipples. What are my options?
So it's not uncommon historically when you did a mastectomy for breast cancer, they would remove the nipple because the nipple it was a concern for site of recurrence, right? You were worried that they would get breast cancer in the nipple or underneath the nipple. There are now many advances, and in some instances, you can do nipple sparing where they don't take the nipple off. But still, I think in a large number of them, again, I don't do breast cancer reconstruction anymore, but this is the information that exists. So in the instance that your nipple, and by nipple, most people are referring to their areola, the pigmented area, and the nipple, the portion that is projecting. Lay terms, we refer to all of it as the nipple, but they're different areas. When your areola, or we call it the nipple areolar complex, when it's been removed after breast cancer, then you need to reconstruct it. So there are 3 options. One option is you don't care, you do nothing. And there are women who opt to just not do it. I just don't want to deal with it. I don't care. It's not important. There are other people who simply just go and get tattoos. They call it sophisticated 3D tattooing, but the reality is it's a tattoo. And tattoos create the pigmented element pretty damn good. In other words, if you look at some people's areolas, no breast cancer, no surgery, and they can barely even see their areola. It's so faint. And some people, their areolas are so dark. So we're pretty good at tattooing these days. And you tattoo the areolar part. But what are you not going to be able to do? Create any projection. The nipple won't, it's flat. And the third option is to do a nipple areolar complex reconstruction, where on the skin, you do flaps, move things around to create a nipple, the part that comes out. Now, historically, it's not that successful because you're dealing with really thin tissue. Remember, they removed everything. It's just skin and a little bit of fat underneath. So to make a projecting nipple is very difficult. So even those nipple areolar complex reconstructions don't do such a wonderful job of making nipple projection. But there are many women who are just natively don't have nipple projection. So, tattooing is a pretty significant part of the reconstruction.
Okay, next one comes from Scarlett Wise.
Scarlett Wise, okay.
Yeah. I have bulky knees from excess fat. What should I do liposuction? Would that work to remove them?
So here is a really, really treacherous area. Caution, caution, caution. Liposuction of knees almost always leads to shitty results. Why? Because it's an area where tissue accumulates, right? You get to your kneecap and the skin doesn't keep moving. So when you liposuction the knee above the knee, you get loose skin. That loose skin then collects over the kneecap. If you have, a lot of people have wrinkly, thin skin. So I have not found the area around the knees to have a very successful aesthetic outcome. And I'm very cautionary if I liposuction around that area. It's usually very judicious, very conservative. And no, there is no good treatment for around the knees. And if anyone tells you, they're lying.
It sucks because your elbows and your knees is what gives away your age, right?
Yeah, well, I mean, at the end of the day, areas that are joints, that move, that have a lot of mobility are hard to correct because they're moving constantly.
Yeah. CeLo 0110.
CeLo 0110.
I have always had some men boobs. As I get older, it seems to be more pronounced. I'm in my 30s. What is the best procedure to reduce this?
Right. So man boobs is very common. It affects many, many men. The medical terminology is gynecomastia. Gynecomastia. And the cause of it is many different kinds. Some is just idiopathic. I was born with it. I had it when I was 15 and it never went away, and I'm reasonably in shape. Some of it is from being overweight, and the estrogen in your fat cells, because you're overweight, causes hypertrophy of growth of the breasts. The stuff that's there is partially fat and partially breast tissue. 2% of all breast cancer in the world is in men. Men have breast tissue, albeit very small, but it's there. Some of it is drug related. Smoking a lot of pot causes man boobs, gynecomastia.
Really?
Oh, yeah.
That's
Oh, yeah. Oh, yeah.
Wow.
So those are the causes. Now, the treatment depends on how bad and what the issues are. So one element of it is I have all this tissue, fat, breast tissue, and the other is I have this excess skin. So if the excess skin is mild, you can get away with just addressing the fat. If the excess skin is a lot, you have to address the excess fat and breast tissue as well as the skin. The overwhelming majority of treatments fall into two categories. One, some type of liposuction. Two, some type of direct excision. I'm actually doing a mastectomy and removing it. I myself am a bigger fan of cutting it out, because it turns out that the fat part comes out really well with liposuction. The breast tissue part does not come out well with liposuction. All of them have some component of breast tissue. So if you liposuction gynecomastia, in many instances, it gets better, but there's still some, let's say, a nugget of breast tissue which needs to be cut out. So the mainstay of gynecomastia treatment is a combination of liposuction combined with directly cutting out the tissue.
Vitamins and supplements pre and post-op. What are the supplements I should avoid before going into surgery or soon after, and why? This is from Kelsey Smith.
So Kelsey Smith asked a very good question, which is supplementation. So supplements can be good for you and supplements can be bad for you. Some supplements prepare you for surgery. Some supplements are risky during surgery. Let's start with the risky ones. The risky ones are the ones that are going to make you what? Bleed. Supplements that make you bleed. And we have 5 pages of supplements you need to avoid. I don't remember any of them. They have all kinds of impact. The impacts are bleeding, some on the liver, some on heart, and so on and so forth. Supplements are powerful. They're drugs. They're just not FDA approved, but they're drugs. If they didn't work, you wouldn't be taking them. So everything has multiple effects. Perfect example is fish oils, flax seeds, chia seeds. Yeah, what's the problem with those? They're really good for your heart. Well, yeah, because they thin your blood. And so if you're on a bunch of flax seeds, chia seeds, and fish oil, and you have some kind of surgery, you could bleed. So we make you stop. Well, how long? A minimum of 2 weeks before, because that stuff lingers around a lot. Now, there are many surgeons who are big fans of believe in supplements as beneficial for surgery. Bromelain, arnica, all kinds of other ones. I am not an expert, and I don't use a lot of them preoperatively as beneficial. I just know I avoid almost all of them because I'm afraid of bleeding. I'm not going to say that I don't believe in supplements as beneficial, because that's ridiculous. Of course it's beneficial. I'm just not an expert, and therefore I'm not in a position to tell you, take this, take that, and their benefits. I don't know how much it impacts the outcome. I obviously don't use a lot of them, and I think I've been quite successful and patients have done well. So you're going to have to Talk to your specific surgeon to see what he or she uses and likes and why. I can tell you across the board, anything that makes you bleed, we're going to have you stop.
Right.
And that's it.
And that's it for this.
It's a wrap. All right. So Q&As are done. Keep it coming. And as I said to you before, write some nice things. Write some nice stuff. Write a review. Subscribe and download. We need you downloading. We need you downloading because when you download, we get credit. When we get credit, they say the show is useful and people like it. And when people like it, we don't get canceled. So, you know what I mean? The usual. At any rate, Maria, thank you for joining me. And we guess I'll see you guys next week. Until then, stay healthy and safe. And we'll see you next week on Plastic Surgery Uncensored.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.